Hey everyone, welcome back to another episode of the Digital Health Show, presented by OSP. Here we tackle the biggest healthcare challenges and look at some of the latest technologies that can solve them. Today's episode is about that healthcare process that results in, unfortunately, hospitals losing over $68 billion a year. No prizes for guessing, and many of you know, it's billing. Today I'm going to talk about the top 3 challenges in healthcare billing. So what's the big deal? You know, a patient books an appointment, they visit you, the provider, and they pay their bill, right? Wrong. Medical billing is so much more complex than when you pay for most other services or products. The medical billing cycle has close to 10 steps, including patient registration, creation of a super bill after reviewing coding and billing compliance, monitoring payer adjudication, and following up on payments and collection. And that's only about half. The ever-changing rules and policies for physician billing services also make it difficult for providers to align their financial policies with real-time changes in medical coding and billing services. So what are these top 3 billing issues that are crushing healthcare organizations under that $68 billion? Well, first, claim denials. Studies show that denials represent 90% of missed revenue opportunities. Claim denials are tricky and complicated and frustrating, all while operating on a deadline. Providers are required to spend too much energy and effort to review subtle little details and changing regulations for documentation before a claim submission. So providers need to make sure their insurance claims are right the first time. Otherwise, you have to allocate more time and resources to process the claim again and sometimes again, which slows down your cash flow. Claims management can be simplified with robust integrations to HIPAA-compliant medical billing systems. Billing systems can help drive payments without facing the problems of payment denials, poor reimbursements, and an inefficient payment schedule. Healthcare claims management requires billing and coding, filing, updating, and processing of medical claims. Medical billing solutions help to streamline this process and paperless claims collections while preventing communications from being lost in the mail. Faster and more accurate claim processing gives more control and flexibility to the practice. With features such as insurance payment listing, electronic claims processing, claims scrubbing, claims tracking, managing claims history, claims reconciliation, and electronic remittance advice and alerts. You can maximize your allowable reimbursements while protecting your revenue. The second area or issue surrounding this is also coding errors. Medical billing and coding are methods through which standards, the ICD-10 codes, are established to categorize patient information records and dictate medical billing towards insurance companies. The CMS reports that medical coding errors have resulted in $16.73 billion in improper payments for fiscal year 2019. Medical coding, when done manually, is an overly complex process that can result in errors that break the revenue cycle process of any hospital. Medical billing and coding software solutions solve this by reducing or eliminating billing inaccuracy and costly mistakes and ensure timely collection of payments. Medical coding automation solutions with predefined ICD-10 codes for appropriate treatment procedures remove the chance for error and subsequent denial of a claim. These medical billing systems can identify and validate the right CPT codes and bring close to 100% accuracy in your claims for better case management. Now, number 3, patient collections. Now that patients are becoming more responsible for a larger portion of their medical costs, you, the provider, must offer solutions that meet patient payment preferences. This obviously encourages your patients to submit payments on time. Surveys show that 65% of consumers are happy to switch providers in order to obtain a better patient payment experience. Hence, providers should offer convenient payment methods and payment plans, whether they be bundled payments, disbursement to patient-oriented care providers, global payment options, or even participating in shared savings plans. They should also offer paperless statements and a variety of payment options, whether that be e-check, credit card, etc. And do that via an online patient portal to utilize the latest payment technologies, such as mobile and text-to-pay. New features like text or email reminders really effectively help communication with patients. Most of you prefer to focus on providing patient care, but care of the patient doesn't end when they leave the exam room. Streamlining the financial and revenue cycle is necessary to make sure that the patient's needs are effectively met. Implementing a robust and advanced billing and coding system will help you overcome invoicing, payment processing, and other issues while lowering operational cost, minimizing costly errors, and improving patient satisfaction, and hopefully increasing your cash flow. Thanks for listening to this podcast, and we would love to hear your feedback. Stay tuned for more health tech updates in our next episode of The Digital Health Show.